Welcome to the Natural Healing Show. Keep it natural with the Natural Healing Show.
Hello, you are listening to the Natural Healing Show for UK Health Radio. I'm your host, Catherine Carrigan, medical intuitive healer, Amazon #1 best-selling author. You can find out more about me and my work at catherinecarrigan.com and unlimitedenergynow.com. While you're there, definitely sign up for my newsletter so you can learn even more about how you can heal yourself naturally. Now, our guest today is Ilsedora Laker. Ilsedora Laker is the CEO of the GNMinstitute.com. And you can find out more about Ilsedora Laker and the German New Medicine at her website, GNMinstitute.com. Welcome, Ilsedora Laker.
Thank you, Catherine. It's my pleasure to be here.
So we're talking today about the German New Medicine. Can you summarize for our audience, what is the German New Medicine?
Well, this is the discovery of Dr. Ricke Gerdhammer. He was a German physician when he discovered this, and he found through a tragedy in his life, in other words, the unexpected death of his son, Dirk, after exploring why both he and his wife developed cancers, he came to the conclusion that that shock that he experienced was responsible for the onset of their cancers. He was living in Italy at the time, and 2 years later, after the death of his son, he got a position at the University of Munich in one of their oncology clinics, specializing in reproductive cancers. And that's where his research really began, because he saw this as an opportunity with about 200 patients in his care to explore the possibility that the onsets of their cancers were also the result of a shock. And to his surprise, because he was a traditional medical doctor, to his surprise, he found that in all cases, they did have a shock, and very specific shocks for specific cancers. And that's how his research began. Then in about 3 or 4 years later, he had already solidified 4 biological laws which help to explain the behavior of all diseases that we have pretty much known.
And what are those 4 biological laws?
Well, the first biological law is called the iron rule of cancer. And that is really the moment in time that we have the shock. It's what we call a very isolating event. Because we are in such a state of surprise, our extremities become cold. We focus only on the problem. We wake up around 3 o'clock in the morning, and then simultaneously with that biological shock, he found through exploring CAT scans of the brain, you can actually see where and how that shock registered in the brain, which is connected to a specific tissue or germ layer on the organ. So this was how he was actually able to verify that a shock was responsible. Then as his research progressed, he discovered there was an iron rule of cancer, which also initiated the law of 2 phases. So that means that all diseases have 2 phases. We have the conflict active phase, which we qualify as a cold phase. And then we have a healing phase or a resolution phase, which is called a hot phase. And all of our diseases fall in either the cold phase or the hot phase. And we can see that traditional medicine has already acknowledged those phases. For example, cancers would be a cold phase. Influenza would be a hot phase, or arthritis would be a hot phase. Anything with an inflammation would be considered a hot phase. And this actually involves about 60% of all diseases known to man, that they are already hot phases. In other words, the conflict is resolved. Then the third biological law helps us to understand the brain and the tissue correlation. Our organs are pretty much made up of different germ layers or cells that are connected or organized, if you will, by the brain, and the brain tells them how to behave. Some organs have 2 germ layers, other organs have all 3. So that means that when you have all 3 germ layers controlled by the brain, that means that 3 different areas of the brain can potentially control those germ layers. So that helps us to understand different kinds of diseases. For example, we have different kinds of kidney disease or different kinds of liver disease, and they're all controlled by different areas of the brain, and they all have different kinds of conflicts that are responsible for them.
Now, so the first biological law of healing is the iron rule of cancer. The second is the law of the 2 phases. So what do you call the third biological law?
It's called the law of the ontogenic system of, no, I'm sorry, that's incorrect. It has to do with the germ layers. The fourth biological law is the ontogenetic system of microbes, which helps to differentiate the germ layers between the microbes. Different microbes have different germ layer affinities. So
the third layer, just for our audience, so I'm following for our audience. So what is the third biological law of healing?
Well, it helps us to connect the actual germ layers to the different areas of the brain.
So is there a summary title for the third law?
Yes. I'm sorry, it escapes my mind at this moment.
It's okay. I know what it's like to be interviewed myself. Sometimes it's all in your brain and all in your mind and then sharing it.
Exactly.
All right. So we're talking about the 4 biological laws of healing discovered by the founder of the German New Medicine. So how does German New Medicine actually work to release a conflict?
Well, first you have to identify exactly what the disease is. In other words, we need an accurate diagnosis. And from there on, Dr. Hammer has given us a great deal of information in his scientific chart where we can actually isolate the nature of the disease, the connection to the brain, the germ layer, what phase it appears in, and on top of that, the kind of conflict that could be responsible for this kind of a manifestation.
Okay, now for our audience, I'm going to share a little bit about what I know about the German New Medicine. So for one of the things that we know in natural healing is I can touch an acupuncture point on my body. I can touch literally any acupuncture point in my body, and a specific area of my brain is going to light up. And my understanding from Dr. Hamer's work is that when we have a conflict that you're talking about, a shock, a surprise, a sudden shock, it creates what's called a Hamer ring. So it's going to create an impact in the brain. So can you explain for our audience, do you call it a Hamer ring? What do you refer to this?
Well, generally speaking, it looks like a target ring. Dr. Hammer, we discussed this many years ago in the beginning. He decided to call it a Hammerschenherd, which is really a German term, but we called it a hammer focus or a hammer lesion in the English-speaking world. And this helps us to understand that the moment we have a biological shock, one of these target rings is going to appear in a very specific area of the brain that is literally programmed by nature to react a specific way at that very moment. So the area of the brain that's going to be affected is going to be completely dependent on the nature of the shock.
Right. So one of the things that we know about scientific research with acupuncture, again, I can touch any acupressure point on my body. It's going to light up a specific area of my brain, or I can light up a specific area of my brain and it will reflex to the gland and organ. So it's this perfect, feedback system.
Exactly. It's a pathway.
Right. So again, how does German new medicine actually work to release these target rings in the brain?
Well, it's what we would qualify as talk therapy, right? We don't use anything else. Very, very little in the way of treatment or remedies or pharmaceuticals are ever used in the GNM. It's very efficient when it's used properly. The way we try to isolate the conflict is to first go to the time that the individual was diagnosed with something. When did their symptoms begin? And depending on the nature of the symptoms, we already know whether or not they are part of the conflict active phase or whether or not they are a healing phase manifestation. In other words, they had resolved something. So I always look in kind of a 6 weeks proximity to the onset of any kind of a health condition. And that's when we begin to dig, because we know the kind of conflict that would be responsible. That's the area that we actually look into. And once we isolate that, it's relatively easy for the patient to be able to understand and to begin to work with that problem if it's a conflict active phase. In other words, it would have to be resolved in the practical or the real sense. Now, if it's the healing phase, most of the time we're faced with what we call chronic conditions. And these chronic conditions are really subject to what we call relapses into conflict or tracks or triggers. And this is what we need to isolate next if the person is in the healing phase. So we have to find the common thread between all of the times that the individual had suffered this problem. And that's the way we begin to understand when it would have developed for the first time. In other words, when they had the biological shock. And by doing so, we stop the reaction to these triggers very, very quickly. In other words, it's immediate. Once the subconscious mind actually understands the origin, then it's no longer subject to these subconscious triggers. And that's when you have control.
So let's give a practical example for our audience. So I'd like you to think about a patient that you worked with, a client that you worked with who had cancer. And you and I both know there's many, many different kinds of cancer. Mm-hmm. So I'm going to take breast cancer. And again, there's many different kinds of breast cancer. So if someone came to you and they had breast cancer, talk us through, what would you do?
Well, first we need the accurate diagnosis. There are two primary breast cancers. One is lobular, which is the glandular kind, and the other kind is intraductal, which involves the milk ducts. Now, they're different from each other in the sense that they are made up of different germ layers, and we have different kinds of conflicts that are responsible for them. And on top of that, they're controlled by different areas of the brain. Then, to complicate things, they behave differently to each other.
Yes. So again, I do realize that I'm putting you on the spot here, and I understand there's all different kinds even of breast cancer. But so what would a patient experience if they came to you? So they get a diagnosis, and then what?
Well, first we figure out where the conflict began, what it involves, the kind of tissue that we're looking at. Is this something that potentially can reverse itself, or is this something that would need intervention? And I can tell you in most cases of breast cancer, they do need intervention. In other words, a lumpectomy at very least. The nature of breast cancer is very difficult because the manifestation is not far beneath the surface of the skin. So if it goes into a healing phase that might be complicated by something else going on in the body, there is a potential for a perforation. In other words, it would break open and create something that is very, very difficult to deal with. So where breast cancers are concerned, I suggest a lumpectomy, and we work out the problems so that there is no recurrence, so that it doesn't become a chronic issue.
So Ilsedora Laker, can you give us an example of some of the kind of patients you work with who've had breast cancer? What are some kinds of examples of conflicts that they've had that contributed to their breast cancer?
Well, the primary breast cancer is really the introductal kind, and here we're talking about separation conflicts. So a separation conflict, as Dr. Hammer originally qualified it, he said this was someone that was torn from my breast. In other words, a woman loses a child suddenly, or loses her partner suddenly. But it doesn't necessarily have to be by death. It could be through divorce, where her children are taken away from her, or her partner finds someone else and files for custody of the children. So it could be that kind of a separation, or it could be a rift in a relationship where the lobular or the glandular kind is concerned. This kind of conflict really involves more around the lines of a worry or an argument situation that causes a rift in a relationship. Now, biologically, there is a reason why the gland would react, and that has to do with the nurturing aspect in that relationship. So a woman would be compelled to nurture someone if they were sick, or if the relationship was problematic, and that would develop into extra cells in the actual glandular tissue of the breast.
And with that, let's take a break and listen to a message from one of our commercial sponsors here at UK Health Radio. You're listening to the Natural Healing Show for UK Health Radio. I'm your host, Catherine Carrigan, medical intuitive healer. We'll be right back and listen to more about Ilsedora Laker and the German New Medicine.
Well, you really caught me off guard there with the third biological law.
Oh, no worries. And Ilsedora, we're taking a break for commercial sponsors, so you'll hang in there, and we need to hang in there. I'll be right back with you, and let's take about a 30-second break.
UK Health Radio, the station that makes you feel good. The station that makes you feel good.
You're listening to the Natural Healing Show for UK Health Radio. I'm your host, Catherine Carrigan, medical intuitive healer, Amazon #1 best-selling author. We're listening today to Ilsedora Laker talking about the German New Medicine. So, is there anything else you wanted to add about the third biological law, Ilsedora?
Well, essentially, it really doesn't have a name like the ontogenetic system of microbes. It really does have to do with defining the different areas of the brain as having control over the different germ layers. So that means that we have, for example, the oldest part of the brain controls the oldest germ layer, the endodermal cells, and then right up to the cerebral cortex, where it controls the ectodermal cells, which are the newest addition to all of our cells in our body. So as our bodies developed through eons, if you will, these different germ layers developed, and they became connected to different areas of the brain as they developed.
So going back to how the German New Medicine works, so if someone comes to you, and we're using the example of cancer, you would identify the original conflict that caused that. How does the German New Medicine go about unwinding or resolving the conflict that caused the illness?
Well, from the moment that we actually discover the biological shock, as we call it now, we used to call it a DHS after Dr. Hammer's son, Dirk Hammer syndrome. Now we call it a biological shock. But the moment that we find that, we have to begin to understand the entire, what I call the scene of the crime, because we experience it as such. It puts us into high alert. So we have to try to understand what other tracks or triggers may have been part of that scenario that still play a role in what is going on in the body. In other words, it's preventing the cancer from completely going through this entire process of the law of two phases, where potentially everything should go back to normal. But if there is interference from what we call tracks, we have to understand that when we have a biological shock, there are billions of bits of information going through our psyche at that moment. It's the most important bits, of course, that will register, but they are potential tracks or reminders. And this is why a lot of diseases become chronic, never mind cancers, but everyday illnesses like the sniffles or allergies or even arthritis.
What's the most common obstacle you have, Ilsedora Laker, with clients who want to use German New Medicine for their healing?
Well, I think the biggest obstacle would be being brought in by a family member. If they don't come of their own volition, then they don't put the same kind of energy into their healing as they would if they came in on their own. I think also some people have a poor memory, and we do need a good memory to be able to understand the scene of the crime, so to speak, and everything that went along with that. When someone has a separation conflict, for example, there is a certain amount of memory loss. So the kinds of diseases or conditions that originate out of a separation conflict take a little bit more time to isolate, but eventually we do get there.
So the German New Medicine sounds very familiar to me and very similar to work that I do as a medical intuitive healer. So I'll take any illness. Let's say we're using the example of breast cancer, and I will look at what are the emotion or emotions behind any illness. And then I look at what are the age or ages at which this pattern started. And I go from that person's current age backwards in time throughout their entire lifetime, finding where the pattern started. It could possibly potentially even go into a past life scenario. And then at each age, I find the emotion or emotions, right? Because there could be many emotions, multiple emotions, especially when you're dealing, as you talk about, with chronic illness or a complex situation, right? So we talked about breast cancer often being a separation conflict. What about male cancer, such as prostate cancer? What kind of conflict frequently leads to prostate cancer?
Well, there are a couple of different scenarios that we could be looking at. Essentially, a prostate cancer has to do with masculinity and territory, where we have to try to identify what it was that the individual lost from their territory, be it a wife or even a mistress or a family member that may have created strife or even challenged their masculinity. Dr. Hammer, in the very beginning, understood from the patients that he interviewed, and of course, this was primarily in Europe, It was in situations where a man was in a relationship and the woman had left him for another man who was more masculine or more virile. So the thing is, the PSA will automatically go up when you are in that kind of a situation. And this is to help your body to become more masculine through hormones, to help to elevate testosterone. But the problem with that is that if we don't have the right microbes to normalize the tissue that built during the conflict active phase, because a prostate cancer will begin to develop the moment that you have a biological shock, then the PSA will remain elevated, even though the conflict may have been resolved and the cells would have stopped growing. So he would, in that kind of a situation, develop just a prostate hyperplasia, or would be diagnosed with a prostate hyperplasia. But the scenario can also take place with his children, where there may have been a rift in their relationship, or he was denied access to having grandchildren or a relationship with his grandchildren.
According to German New Medicine, what kind of conflict frequently leads to lymphoma?
Well, there are different kinds of lymphoma. We have Hodgkin's and then we have non-Hodgkin's. We have a lymphoma that develops in the neck, literally from the ears down, right through the mediastinum, which is the upper body cavity, down to the diaphragm. And there are lymph tissues that are controlled by the cerebrum, the cerebral cortex. And they respond primarily to either going into a very dangerous situation or not having any control in a situation that was dangerous. And this is controlled by the frontal lobe. Now, the other kind of lymph cancer involves the lymph nodes and the lymph vessels, which are mesodermal in origin, and they're controlled by the cerebral medulla, or better known as the white matter. But what they have in common is that during the conflict active phase, we have nothing going on physically that we know of. We recognize the stress phase. But on a cellular level, there is a certain amount of either ulcerations or necrosis going on the tissue, like Swiss cheese, that when the conflict resolves, will undergo the repair. And this is the wonderful thing about the body. It attempts to repair. Now, when this happens in either one of those kinds of lymph tissues, there will be a swelling. And this is when you will have a diagnosis of either Hodgkin's or non-Hodgkin's lymphoma.
Now, what kind of conflict frequently leads to brain tumors?
Well, that could be anything, because brain tumors are literally the brain's attempt to repair the damage that was done to the neurons during the conflict active phase. But this doesn't happen with every conflict. A lot of conflicts are short term. But if we're looking at a conflict that you've experienced, say, in your 20s, and you go into a big healing phase in your 50s or your 60s, then yes, it can lead to a mass known as what we call a brain tumor. But the process is really such that the glial cells of the brain will attempt to reconnect the neurons or the damage that was done during the conflict activity. And this is when we will develop a brain tumor.
Now, we've been talking about target rings, also known as Hamer focus or Hamer lesions. Mm-hmm. Does a person need to have a CAT scan to be able to understand what's happening according to German New Medicine?
Well, personally, I prefer it, but obviously it's not feasible in every case. Certainly in serious illnesses, it is preferable, because We are able to identify the different phases also through the CAT scan. In other words, we can see if there is conflict activity, or we can see if the individual is in what we call a hanging conflict. In other words, it's been there for a while, but it has diminished tremendously and it's not doing damage. Or we can see a healing phase. And obviously, we can see dramatic healing phases, such as edema, which is fluid, which will develop after the conflict is resolved. And then, of course, if there is a big repair phase in progress, then we can also identify that.
And I assume this is a CAT scan of the brain, correct?
Yes, it's a CT, computerized tomography. And it isn't remotely anything like an MRI, because we can't see the target rings or the different phases that the individual is in with an MRI.
So is Ilsedora Laker, you're the CEO of the GNM Institute. So we understand you're not a medical doctor, but
Right.
do you personally evaluate these CAT scans of the brain to understand what's happening according to German New Medicine?
Yes, I learned how to do that very early on in my travels in the 1990s. My first teacher of the German New Medicine was Dr. Robert Guinet, and he was a protege of Dr. Hammer. He introduced me to Dr. Hammer in 99, and I was already thankfully prepared enough to be able to work with Dr. Hammer from there on. But this is something that anyone can learn regardless of background, but it does take a little bit of expertise and experience to be able to decipher properly. My background is in natural medicine, so I already had anatomy and physiology, and of course, clinical herbalism. So when I came across Dr. Hammer's work, I took to it like a duck to water. It just filled in all the blanks for me. And when I found out about this new diagnostic tool, it really piqued my interest. And I really wanted to learn how to do that. So thankfully, the universe gave me the opportunity.
So how does a German New Medicine practitioner evaluate a CAT scan of the brain? What do you look for?
Well, we look for either conflict activity or healing phases.
And what does that look like?
Well, when you have a conflict active phase that has been recently initiated, you do still see the clarity of the target ring. When someone is in a healing phase, and mostly when I have the CTs, we can identify old healing phases which could be decades old, or we could identify new healing phases which appear like the bicycle spokes when you see these target rings beginning to break up. But the trick is not in identifying the target rings and how they appear as much as it is the position that they are in, because the angle of the CT can differ from patient to patient. So you have to be very precise to understand what relay is affected with what we actually see.
So as we know, there are rules and laws regarding traditional medicine. Is it legal for a German New Medicine practitioner to evaluate CAT scans of the brain?
Well, we've never encountered a problem because this is a new field altogether. We're not diagnosing per se. What we're actually doing is looking for conflict activity that is either active or resolved.
So you're actually looking for these focus rings.
Yes, exactly.
And so you mentioned that German New Medicine resolves things through talk therapy. So let's say you've got a client, again, you've diagnosed them, you've looked at their CAT scans. Do you go and talk through what the conflict was about? How do you use talk therapy to resolve conflict?
Well, Dr. Hammer was able to identify 25 different areas of the brain that were associated to one biological shock at one point. So even these finer nuances, or what we call tracks, will register. And when we begin to look at these areas, obviously they will appear to be in the same stage of either activity or healing. When we look at all of these areas that were simultaneously affected, we have a clearer picture of what the scene of the crime actually entailed. So it's quite astonishing what we can identify where the actual conflict was concerned.
Right. And so we're talking about resolving the conflict. And you mentioned that you all use talk therapy. So does German New Medicine help to support the value of psychotherapy and talk therapy?
Well, it's not really psychotherapy or talk theory the way traditional medicine understands it. We're really looking at investigating what happened. So it's more detective work than anything, because once we unearth what happened at that moment of the biological shock, there is a visible shift in the individual when they have that, when they make that connection, when they have that realization that, yes, this was it. And that's why I responded the way I did. So that in itself is considerably different from traditional psychotherapy.
And with that, let's take a break and listen to a message from one of our commercial sponsors. We'll be right back in about 30 seconds. This is Catherine Carrigan, Medical Intuitive Healer.
UK Health Radio, the station that makes you feel good. UK Health Radio, the station that makes you feel good.
Ilsedora Laker, in Europe and Canada, you have socialized medicine. In the US, most people have insurance or they pay themselves. How much does a CAT scan of the brain actually cost? So if someone decides, I would like to work with German New Medicine, I need to get a CAT scan of the brain, how much is that going to cost the average individual?
Well, in Canada, all we need is a requisition from a physician to get a CT of the brain. Obviously, it has to be justified as, for example, an injury. If someone fell and they hit their head on the sidewalk, then that would be justified. Or if they had a health condition such as a double vision, or they were all of a sudden developed migraines or something to do with the head, in those cases, we wouldn't have to pay for it. To pay for one privately, you still need to have a requisition from a medical doctor in Canada. In the US, it's a little bit different from what I understand. From state to state, you may even get a requisition from either a naturopath or a chiropractor. You wouldn't need a medical doctor's requisition. And in most cases, insurances do pay for it.
Okay, and no idea what the cost would be?
I'm sorry, it would depend on the clinic.
Right.
Yeah.
Now, so Dr. Hamer's work was primarily with cancer. Let's go through some more of the common cancers. So what kind of conflict tends to lead to liver cancer?
Well, here we're looking at two different kinds of liver cancers. The body of the liver, which is called the liver parenchyma, would develop liver nodules. And that is something that would develop from the moment that you entered into what we call a starvation conflict. And here we could be looking at a severe financial loss or a job loss, and you're already in debt and you don't know how to make ends meet. I've actually seen this kind of cancer develop in patients that were unable to eat because they were in cancer treatment.
Mm.
So we're looking at a real kind of starvation conflict. The other kind of liver cancer involves the bile ducts. And this is controlled by a different area of the brain where you have a degeneration of cells during the conflict active phase. Biologically, this is to enlarge the bile ducts. And you don't notice anything except maybe a very mild discomfort in the liver area occasionally during the conflict active phase. But when you go into the healing phase, this is when the tissue will begin to swell and you can develop an occlusion and be diagnosed with a bile duct cancer. But they both qualify as liver cancers.
And is the second one also about conflict related to starvation?
Well, not quite. In this case, it usually has to do with having something stolen from you. This is also something that involves an anger. So this is a territorial anger with the nuance of being ripped off or having something stolen from you.
Now, what kind of conflict leads to lung cancer, according to German New Medicine?
Well, here we have the same thing again. We have two kinds. We have the bronchial, which involves the tubes, and that behaves very similarly to the bile duct cancer I just explained. But here we're looking at a territorial fear conflict, and the fear is usually has something to do with an act of aggression, either within your territory or just outside of your territory. So there's an act of aggression that is very, very fearful. And here again, you only develop the symptoms when you're in the healing phase. So when the bronchi are repairing, this is when you develop the manifestation. The lung alveoli, which involves the body of the lungs, that responds to a fear of death conflict. And this is usually the kind of thing that will kick in if you have a cancer diagnosis already and you've been fighting it for a few years. This is the kind of thing that will kick in when you're no longer given any hope to survive this. And this is when you would develop lung nodules. But the interesting thing about both the liver and the lung cancers in this case has to do with the fact that multiple liver nodules or multiple lung nodules have to do with a conflict for self, whereas a single lung nodule or a single liver nodule has to do for the well-being of someone else, a close loved one.
Now, as you know, given your background in natural healing, a lot of focus is about nutrition. Mm-hmm. What is German New Medicine's attitude about nutrition? Is it that it doesn't matter, we can eat whatever we like as long as we resolve the conflicts? What is the approach that German New Medicine takes about nutrition?
Well, I like to make the comparison that a couple of 100 years ago, it was hand to mouth, right? It was all about survival. Mm-hmm. And whenever someone became quite ill, for example, with a condition known as consumption, which is commonly known as TB, if the person had been emaciated or was not eating well and they were just drinking tea and toast and living that way, they would likely not survive this condition. So it's important for us to remain healthy and to feed our bodies with good foods. Personally, I prefer to be a vegan, but then I'm the right blood type to be a vegan. Some of my patients, and I saw this early on in my career, that if they went on a fast or if they went on a raw diet and they were a type O diet, they would emaciate very, very quickly because their protein needs are much, much higher than that of A type. So I think it depends on the person, and we really need to be careful as to what our bodies really need to remain healthy so that when we do go into one of these healing phases, that we can withstand them.
So Ilsedora Laker, CEO of GNMinstitute.com, if someone is listening to this broadcast and they realize that they've recently gone through a shock, they got a divorce or they lost their job or they lost a loved one suddenly, how can we go about resolving our conflicts before we get sick, according to German New Medicine?
Well, most of the time we don't even realize that we are in conflict, right? And even so, when we have a biological shock, let's say in our first 20 years of life, it's been my experience that they register, but for the most part, we don't become ill. It's when it's reawakened that we will develop some kind of a physical issue. So it's at the time that we develop our symptoms that we really begin to pay attention. But because we now understand Dr. Hamer's 5 biological laws and the concept of the DHS, that means that we now have the opportunity to begin to understand ourselves a little bit better and be aware when we do have a biological shock.
I know for myself, when I go through exceptionally difficult periods of my life, I do the inner work so I resolve the issues so that I don't get sick. Now, you mentioned earlier that there were 4 biological laws of healing, and then you just said there's 5. So
yes,
what's the 5th biological law of healing?
Well, this is the quintessence, as Dr. Hamer calls it, and it helps us to understand why we become sick. There is a biological meaning behind all of our illnesses, so to speak. All conditions have a biological meaning. For example, fluid retention. This is our kidneys stepping back, holding back fluid because we are in survival mode. So just fluid retention helps us to understand that we are in a biological shock and we are in this stress phase where our bodies need to retain water.
So Ilsedora Laker, any final thoughts for our audience about German New Medicine and the 5 biological laws of healing?
Well, I think that the more people begin to embrace Dr. Hamer's work, the more they will begin to realize that we not only will have control over diseases one day, but we will also be able to use this as a stepping stone in our own spiritual evolution, because the bottom line here is practicing harmlessness. As long as we practice harmlessness and do not injure others, then people will remain healthy. If we live according to these biological laws, then we can have good health all of our lives.
Great information. And Candace Pert, the co-discoverer of endorphins, she had a wonderful quote. She said, if you want to understand what's going on with your unconscious mind, just look down at your body. And there is no doubt that those of us in natural healing talk about the deeper meaning behind our illnesses. And as we resolve these conflicts, we can unwind the true causes of sickness. You've been listening to the Natural Healing Show for UK Health Radio. I'm your host, Catherine Carrigan, medical intuitive healer, Amazon #1 bestselling author. You can find out more about me and my work at catherinecarrigan.com and unlimitedenergynow.com. While you're there, definitely sign up for my newsletter and learn how you can heal yourself naturally. Our guest today has been Ilsedora Laker, CEO of the GNM Institute. And remember, when you resolve the deep conflicts that lead to illness, you can free yourself naturally. Thank you so much for listening, and we'll see you next time.
Thank you for listening to the Natural Healing Show. Keep it natural with the Natural Healing Show.